Hello, welcome to chapter 8. We now get to talk about skin disorders. So this chapter starts on page 142 of your book. So when we're talking about skin disorders, we first have to start with an overall overview of their integumentary system. So your biggest one of the integumentary system is going to be your skin, okay? Your biggest organ, right? And so why do we need our skin? And, well, obviously it keeps things together, but what are the other reasons why we need this? Well, it's going to act as our first line of defense when it's unbroken. The second that you break that surface, well, then we can obviously have like an input into the body system, and then it can lead to infection, etc. But when it's all intact, it's going to act as the first line of defense. The skin is also going to prevent excessive fluid loss. It also controls body temperature because we have cutaneous vasodilation, which means that those blood vessels are going to get bigger, therefore allowing heat to escape. And then we also have the secretion and the evaporation of sweat. So during my workout this morning, I sweat a lot, right? And this is because my body was trying to make sure that my body temperature, stayed at that homeostatic level of 37 degrees Celsius. um, is also active in our sensory perception. And so this is an important defense against environmental hazards. If I run into things or if I see something that's sharp and I poke myself, right, then that's going to be like, oh my gosh, Janet, that was really sharp. So maybe you shouldn't do that again, right? And so it's going to help us with that sensory perception. And then also our skin's very important because it helps us to synthesize or make vitamin D. And so all that we need to have that happen is the exposure to just a small amount of UV light. So living in Michigan, we know that our winters a lot of times have cloud covering, and I'm looking outside right now and we're actually expecting a huge snowstorm to start momentarily. And so a lot of people use the UV lights, like the safe ones, right? The seasonal lights, so that we can still get exposure to our UV lights so that we can help to fight off seasonal depression and also make sure that our vitamin D is being synthesized. So with our skin, the normal skin, we have layers. The epidermis is avascular, meaning it doesn't have vascularization, no blood vessels, right? The dermis, and then we have the subcutaneous tissue, which is called the hypodermis. Looking specifically at the epidermis itself has 5 layers, and these are going to be varying in thickness. And so the first layer is going to be keratin, and this is what happens, or what we use to help waterproof the skin. Okay, so if I take my water bottle here and I put some on my hand, it'll pill up in a little ball, right? And that's because I'm waterproof, right? If I go swimming or I take a shower, I'm not absorbing all that water. So keratin is the important factor that helps to waterproof the skin. We also have melanin, and this is the skin pigment. And so this is what determines our skin color. And the production of melanin depends on multiple different genes as well as the environment you live in. Living in Michigan, I also burn in the sun because I just don't have a very good tanning reflex, right? I don't have that much melanin. My adorable, lovely stepdaughter is moving to Florida in a couple weeks, and she has darker skin tones, right? And she has a lot more melanin, and so she tans in 2 seconds. And so the genetics is going to play a huge role in that, and then as well as your environment. She's going to move to Miami, and she's going to have one heck of a tan year round. I'm going to be ghostly white, but that's okay. We also have albinism, and this is when we have a lack of melatonin production, and so you have a lack of pigmentation in your skin. There's a disease called vitiligo, and this is where you have small areas of hypopigmentation. Remember, hypo means less or lower. And my dad, this amazing person right here, he actually had vitiligo on his legs, and my sister has small little spots of it too. And so it just is areas that look very white because there is no pigmentation in there. Then you also can have melasma, and this would be where you have patches of darker skin. Looking specifically at the layers of the epidermis, we have the striatum basale, or the basal striatum layer, right? And so this is where we have that mitotic activity. We also have the stratum spinosum, and this is where the cells are going to be connected by desmosomes. And desmosomes are just a specific type of connective tissue cells. This is also where your protein is going to be made or synthesized. You have your stratum granulosum, and so this would be like your granular layer, and this is where that keratin formation is actually going to begin. Then you also have your stratum luteum and your stratum corneum, and the corneum is going to be that waterproofing barrier that we're talking about. So I keep looking over to your book here so that we can look and see if we have very fun layers and discussion about the different layers of the skin. But it kind of pops right into like diseases. That's okay. All right, so what is the dermis? Well, the dermis is actually connective tissue. And because of this, it's going to help to connect things. So you can think of a kind of like a lattice work. And so with that, you're going to have elastic and collagen fibers in that connective tissue layer. And this is what's going to help things stick together or connect. This is also going to help to give us flexibility as well as the strength of the skin. This dermis layer also contains nerves and blood vessels, and also with sensory receptors. And those sensory receptors are very important. Think of everything that your skin can sense. Pressure, right? If I'm pushing on myself hard versus just lightly tapping, touch, somebody grabs my hand, I can feel that. If I dropped a saw in my hand and I have a lovely little scar right there, right? So that was very painful because, saws are not supposed to go into flesh and left a scar. But anyway, that was very painful. Heat. I'm right-handed, can you tell? I've also taken my hand and put it on a very hot stove that was red hot, but apparently I didn't see the red and I burned it. So I was very sensitive to the heat because I burned down almost to the bone. It was fantastic. And then also cold. I ride horses. Yesterday I had a riding lesson. It was 7 degrees outside. Even though I had gloves on, my fingers were still getting numb, right? So anyway, the dermal layer is going to be very important for doing all these sensory functions. What about appendages of the skin? So an appendage is just something that's attached to or associated with the ground layer, right? So your skin. So you have your hair follicles. So look at your arm, right? These are going to be where your hair is. And so they have the stratum basale, and this is the hair producing layer. And the erector pili muscles, these are the ones that are associated with the hair follicle. And so this is kind of a fun thing. Like if you ever watch horror movies or you get scared and like the hair stands up on your skin, that's from the function of the erector pili muscles. They're the ones that actually are going to like squeeze up against the shaft and actually move the position of the hair. So it's kind of a fun little, I love to say erector pili muscles because they're just kind of cute. All right, you also have your sebaceous glands, and these are the ones that are going to be producing sebum. And this is going to be a secretion that increases at the time of puberty. And this sebum is going to be influencing the sex hormones, okay? And that would be secreted from your sebaceous glands. You also have your sweat glands, and these are eccrine, and these are all over the body. And then you also have more specific ones, and these would be the apocrine, the sweat glands. And these would be in your axillae, your scalp, your face, and the external genitalia. The hypodermis, remember hypo means below. So hypodermis is beneath the dermis. And this is made of connective tissue as well as fat cells, macrophages, fibroblasts, larger blood vessels, as well as nerves. Okay. And so this is a fun diagram of the skin, and this is figure 8.1 that's on page 143. And so you can see that you have your hair, and then it's planted in there deep with the hair follicle. You have that adipose or fat tissue, and then you can see the different layers. You have your subcutaneous tissue, you have your dermis, and then you have your epidermis. And then you can see, where the capillaries are, the sebaceous glands, smooth muscle, etc. So you can see that they're very well integrated. And then also, we'll just point out these sensory receptors, right? So your sensory receptors are there, and they're also in like the surface of the skin. And so this is why, if you run your hand very lightly over, you can feel that, right? Your hands are actually one of the most sensitive parts of your body. And that's because you're very well innervated with our sensory receptors. So, when we talk about patho, right? We talk about when things go wrong and they cause things like diseases. Well, we have normal resident flora that are on the skin, okay? And so these are cool to have because they keep us alive and healthy, but sometimes they can get out of hand and then that can cause an infection, right? Or if we puncture that line of defense, on our skin because I cut myself with a saw because I'm brilliant or, whatever, then, it can lead to infections, etc. So let's talk about the normal flora of the skin. Well, you have mixed flora, and these are components that differ in various areas of the body. You also have microbes, and these reside underneath your fingernails. No matter how much you clean, there's always going to be microbes in there. These can also, exist in the hair follicles as well as in the glands. Again, you can have opportunistic infections that may occur because you have an injury or another inflammatory lesion that occurs, and it kind of opens the highway express into, through that barrier system and into the body. And the infection may spread systemically from skin lesions. And what that means is, it can go from, your hand, your local hand, and then it can spread through your whole body system. So that would be a systemic infection. So talking about specific disorders of the skin, let's talk about the skin lesions, okay? And so the skin lesions, this starts on page 144. And so the physiologic appearance, the physical appearance of the lesion is necessary in order to make a diagnosis. And our skin lesions can be caused by systemic disorders such as liver disease, systemic infections such as chickenpox, allergies to ingested foods or drugs, as well as localized factors such as, exposure to toxins in a local area. So, I spill something on my hand, then it can cause a lesion. That would be a localized exposure. Your type of lesion is going to depend on a couple different factors. One is the location, the other is the length of time the lesion's been present, changes that may occur over time, also the physical appearance, such as color, elevation, texture, and the type of exudate. So what's oozing out of it, right? And then also whether or not you have the presence of pain or protrusus, and this is basically like the itching, okay? So some common skin lesions are here, and this is figure 8.2 on page 145 of your book. So here you have what's considered to be a macule, and so this one is going to be a flat, circumscribed skin lesion. Over here in B, you have a nodule, and so it's going to be like a node, right? And so this is going to be where it's a firm, raised, and deep skin lesion. Down here, you have a papule, or a papule. I guess you can make it sound more easy. And this would be a small solid elevation. And then you have a pustule. And so pustule kind of has the root word of pus, right? And so this is going to be a raised lesion, and it's often filled with a head or an exudate, which we consider to be pus. Okay. Down here in E, you have a vesicle, and this is where you have a vesicle or a blister. This is going to be thin-walled, raised, and fluid-filled. So think of like a first-degree burn, right? It blisters, and then you're not supposed to, but you can pop it and like just a clear liquid comes out, right? You can also have a plaque, and this is where you're going to have a slightly elevated rise here. It is still going to be flat, and it's going to be a scale-like lesion. And so if you look closely in this figure or in your book, again on page 145, you can see that there's like a texture to the outside of it, and that would be like the scaliness. You can also have an ulcer, okay? And this is where you actually have a cavity that forms within the tissue. Then finally, we can have a fissure. And so I think of this kind of like a Grand Canyon is a fissure, right? And so this is where we actually have a crack in the tissue. And so those are our common types of skin lesions. So this is a table, this is table 8.1 on page 146, and this is the description of some of the different skin lesions. And so this would be great to put on like flashcards, and you can actually put a picture or draw a picture of the type of skin lesion it is too. But it goes from macule to papule to the nodule to the pustule, vesicle, plaque, crust, lichenification, a keloid lesion that occurs, ulcers, fissures, erosion, as well as comedone. Okay, so this is a great little summary and description of some of the different types of skin lesions that you'll need to be familiar with. So what do we do to diagnose these? Well, basically we're going to culture and stain skin specimens, so samples, right? And so if we're looking for bacterial infections, then we're going to be looking at microscopic and direct observations of those cultures, right? And there are specific procedures for fungal or parasitic infections. And you guys learned this in micro, that there's different diagnostic tests, different staining protocols for all the different types of things that you're trying to culture or stain. You can also do a biopsy, and this is where you would have a detection of malignant changes. And so we talked about malignancy last week, right? And so basically what this is it's a safeguard prior to or following the removal of skin lesions. And so you want to make sure that you have clear margins, that there are no cancer cells that are still there, before you stitch the patient back up and send them on their merry way. You also have blood tests, and these are very helpful in the diagnosis of conditions that can be caused by an allergy or from an abnormal immune reaction. And so blood tests can be incredibly powerful. You can also use skin testing or using a patch or the scratch method. My stepdaughter, Caitlin, had to have like the scratches, I think it was on her back with her whole back, and she like welted like crazy. My husband, he got the blood test for allergies, and he's allergic to me. Just kidding. He's allergic to pretty much life. So dust, mold, pet dander, everything. And I'm always around our, we have a cat, my cat and my horse. So he really is allergic to me, but that's okay. I still love him. All right. So what about how we treat these? Well, when we have the protrusus, then this is going to be using topical agents in order to reduce the sensation that's causing the pain. And this also can be treated by antihistamines or glucocorticoids. The best one is going to be the avoidance of allergens so that we can reduce the risk of recurrence. Unfortunately, my husband, he can't not live in the house, right? And I mean, we clean all the time, but it's still allergies and we still have cats. So he's on nasal inhalers and stuff like that. If you do develop an infection, well, this may require an antibiotic treatment. And some of them can be precancerous lesions. And so because of that, then you would want to have surgery, laser therapy, or electrodissection, or cryosurgery in order to get rid of that lesion so that the cancer can't spread. So what about skin tumors? Well, you have keratosis, right? And so this is one of the types of lesions that are usually benign. Okay, I'm trying to look for it in your book. This is on page 157, okay? And so the benign lesions are usually associated with aging or skin damage. And so you have seborrheic keratosis, and this would be where we have a proliferation or an overgrowth of basal cells, and this can lead to oval evaluation. And this, or elevation, not evaluation. We're not going to look at an oval. We're going to look at it and see what type it is. And that oval can either be smooth or rough. You can also have actinic keratosis, and this would be on the skin that was exposed to UV radiation. And this is very common in fair-skinned people, and the lesions can appear as pigmented or as a scaly patch. Okay. So what about warning signs of cancer? Well, we talked a little bit about this last week when we were talking about cancers in general, but basically one of the biggest warning signs is that it's a sore that does not heal. You can have a change in the shape, the color, or the texture of a lesion, and this can especially occur in an expanding irregular circumference or the surface of the area. You can also have the presence of new moles or oddly shaped lesions that can develop. Then, the skin lesion that bleeds repeatedly or oozes fluid or it itches. These can all be warning signs of cancer. So some general guidelines to reduce the risk of skin cancers would be, well, reduce your sun exposure at midday and early afternoon. That's when the sun is the strongest. So if you have to be out in the sun, be out in the early morning or in the late day, right? Because when the sun is very intense, then it can burn you a lot quicker. Also, cover up with clothing and remain in the shade. So you'll still get some UV, but remaining in the shade is going to stop some of that direct sun. Well, obviously the direct sun because you're in the shade. Wear broad-brimmed hats to protect the face and neck. So I used to be on a medication that actually made me allergic to the sun, and so I would be out in the sun for 3 minutes and I would be red as a lobster. And so I would have to wear like linen, right? So very thin clothes with like long sleeves, and I had blankets. My mom was so amazing and made them for me so that I could cover up in the sun because I would just burn so much. And so this is great. They also have UV clothes now, and so there are some that have like an SPF of like 30 in the actual clothing, so it's cool. Also use sunscreen and sunblock to try to make sure that we protect our skin. And especially with the kids, the infants and the children's, make sure that, you cover them in sunscreen and stuff before you let them outside to play because, I mean, they don't know any better and they like to play all day. And so we want to make sure to keep them protected. So talking a little bit about specific types of cancer, we have the squamous cell carcinoma. And this is on page 157. And so this is a painless malignant tumor of the epidermis. The lesions are most commonly found on an exposed area of the skin, but also they can be found in the oral cavity, specifically mostly in the face and neck or on the base of the tongue. There's excellent prognosis when the lesion is removed within a reasonable amount of time because it will not allow it to spread, right? And the invasive types are going to arise from a pre-malignant condition that is not found and not detected, and so therefore it's not treated. So this is a picture, and it's from figure 8.14 on page 158. And this is a picture of squamous cell carcinoma on the skin. So you can see that, it's very raised, it's irregular, it's textured, so all of those things that we were talking about before. What about a malignant melanoma? Well, the malignant melanomas, this is on page 157, just for a couple sentences, and then it hops to page 158. This is a highly metastatic form of skin cancer, so it can spread very easily. And this develops in melanocytes. And this is from a nevus, or otherwise known as a mole. And these often appear as a multicolored lesion with an irregular border. They can grow quickly, they can change in shape, color, and texture, and these may bleed. And the treatment for these would be the surgical removal and radiation plus the chemotherapy. And so this would be an example. This is from figure 8.14, and this is an example of a squamous cell carcinoma on a sun-exposed ear. So what you can see the ear canal here and then the earlobes down here. My brother-in-law is a Mohs surgeon, and he actually does skin cancer removals with specialized surgery. And so he deals with these all the time. So try to make sure to use your sunscreen. Okay? So we have this method, right? And it's called the ABCDs of melanoma. And so if melanoma is suspected in any mole that shows the change in appearance, a change in the border, a change in the color, or the change in the diameter, that's when we're going to be very cautious, and we want to really make sure that we're catching all these things. So just remember the ABCDs of melanoma. And so this is figure 8.15 on page 158, and this is showing a malignant melanoma. And you can see again that it's really dark, it's irregular shaped, it has, some rises, it looks like there's some scaling. So so we want to make sure that we're looking for those ABCDs and just keeping an eye on them to see how quickly they spread and if they do spread, etc. Talking about Caposisarcoma, this is on page 158 of your book. This occurs in those patients with AIDS and other immunodeficiencies, and this may affect the viscera as well as the skin. The malignant cells can arise from the endothelium in small blood vessels, and they're going to cause you to have purplish macules. And these are non-puretic, which means they're not like, puffy or anything like that. And they are non-painful. In an immunocompromised patient, these lesions can develop rapidly over the upper body. And then we can also use a combination of radiation, chemotherapy, surgery, and biological therapy in order to treat this. And so again, this is discussed a little further on page 158 and 159. So we'll see you for the next chapter.